Hello guys, hope you are all okay and you're all enjoying your life, and welcome back to Dr. Arshad Nadeem Awan Radiology and Ultrasound teaching video. Today I am going to discuss about the differential diagnosis of the adrenal calcification. If you are reporting general plain x-rays or you're doing CT reporting, you may come across calcification both in adults and children. As far as their differentials are concerned, you may include the cystic disease like birth trauma or any hemorrhage or any veno-occlusive disorder or thrombosis, neuroblastoma, ganglioneuroma or Ullmann's disease. In adult, you can also appreciate the cystic diseases. There is also Addison's disease which give rise to calcification. There may be inflammatory disease, maybe tuberculosis or histoplasmosis, few chromocytoma. So there are multiple differentials which I have listed in this video, along with that which characteristic of the calcification you may be able to see on either plain x-rays or CT images. So one should have to have this list in front of you like while you are reporting the adrenal calcifications. So let's start watching this video. Keeping in view the adrenal calcification as far as the children x-rays and CT scans are concerned, if you come across any calcification, the first topmost differential would be a cystic disease. This cystic disease may be because of birth trauma like hemorrhage because or during the birth, or there might be some infection, or there may be some hemorrhagic disorders going on, or you may think of arterial or venous thrombosis. So in your differential for the children adrenal calcification, the top differential would be a cystic disease. On the top, the second top, neuroblastoma would be your differential. It should be included in your differential if you are reporting the children x-rays or CT scan. So most of the time, in 50% you can pick this neuroblastoma calcification on the plain film, and 90% on the CT, because CT is the modality of choice for the calcification no matter where it is. So the type of the calcification which you will see on the neuroblastoma or within the neuroblastoma would be an ill-defined, stippled and non-homogeneous calcification. This would be characteristic of the neuroblastoma. The next differential would be ganglioneuroma in the children. So far the ganglioneuroma calcifications are concerned, it will be again ill-defined, it would be stippled calcification, it would be non-homogeneous calcification, it would be similar to the calcification of the neuroblastoma. In the differentials of the children's adrenal calcification, you must include Ullmann's disease. You will come across hepatomegaly, there will be splenomegaly, and there will be also enlargement of the adrenal gland. So adrenomegaly will be there with the punctate cortical adrenal calcification, that is pathognomonic, so there will be a calcification. It would be a punctate in nature and it will involve the cortical part, and this is pathognomonic for the Ullmann's disease. If we talk about the calcification in the adult, so far the adrenal calcifications are concerned. So again, on the top list, you must always think of the cystic disease, that may be your hemorrhage from the birth trauma, it may be your infection, or you must think of any hemorrhagic disorder which may lead to calcification, and arteriovenous disorders may also be included in this category. In the adult, the differential include carcinoma of the adrenal glands. So the characteristic of the carcinoma of the adrenal gland would be the tumor would be of increase in large in size. This would be a 14 centimeter. This is one of the characteristic of the adrenal cancer. And as far as the calcifications are concerned, it would be irregular and it would be punctate calcification with a large tumor of the adrenal gland. So you must think of carcinoma of the adrenal gland. While talking about the adrenal calcifications in the adult, you must think of ganglioneuroma. Ganglioneuroma is usually it happens in quite young age would be 20 years, and to some extent the calcification type would be flocculent. So you will see the flocculent calcification, and that would be a ganglioneuroma. Addison disease will also be included in adrenal calcifications in adult age group, and this is commonly because of the either autoimmune disease, or you must think of metastasis deposits. So because of metastasis or autoimmune disease, the disease which is called as Addison disease should be included in the differentials of the adrenal calcification in the adult age group. Inflammation is the next differential diagnosis, but it will also give you certain history or previous medical record will also help you to put this particular diagnosis for the adrenal calcification, and the top one is the tuberculosis. Tuberculosis, whether it is in the adrenal gland or in the liver or spleen, all the way it gives rise to calcification, and calcific foci would be seen, and this would be because of the tuberculosis. Or in other words, there may be another infection that would be a histoplasmosis, and the characteristic of histoplasmosis is also it will turn up into calcification. So you must include inflammation and inflammatory conditions while you are reporting the adrenal calcifications of the adult. But mind you that you should also take the history, because the history will support you for diagnosing these inflammatory conditions. And in the end, I will include the pheochromocytoma. Pheochromocytoma is an adrenal disease with the calcification, but the calcification in pheochromocytoma is very, very rare. But if in case if it is present, so there will be a particular presentation of the calcification, that would be a eggshell calcification, very pathognomic, and it's easy to appreciate because of its particular appearance, and that would be a eggshell calcification. If there is eggshell calcification, you can include pheochromocytoma in your differentials for the adrenal calcification, particularly in adults.